Good evening. My name is Kenya Ross McDonald. In this evening's session, topic is chronic disease management and preventative solutions in relation to health informatics. And so we want to talk about how health informatics and the advancement of technology can help with preventative care solutions as well as manage chronic diseases and conditions. So we want to start first with some definitions. So the first definition is preventative care. So preventative care is the care you receive to prevent illnesses. And so that can be by way of immunizations, um, or screenings. And so once a year, a person should go to the doctor and get what's called a well visit or a well check. And this is basically when you go, they're gonna check your blood pressure. You can get blood work to check your cholesterol levels, your hemoglobin A1C, which checks for diabetes. Um, for a woman, a mammogram, screening mammogram checks for breast cancer. If you're of age, colon cancer, screenings for colon cancer. So all of these things are preventative care. This is basically you going and checking on your health. And so, which leads me to chronic diseases. So, when you're not getting that preventative care, this is where chronic diseases or conditions come into play. So, a chronic disease is a long lasting condition that usually can be controlled but not cured. So, this means basically it can be managed, but it's typically not something that you can get rid of. And this is conditions such as cardiovascular disease, diabetes, asthma, even depression is considered a chronic disease. And so these are all things that you can manage, but there's no cure. And if you don't manage them well, they can affect your quality of life and can sometimes be the cause of your end of life. So that's why preventative care is so important. And that's where healthcare informatics and advanced technology come into play. Um, with health informatics and advanced technology, it gives a patient solutions. And then it helps with healthcare costs as well. And so a patient can actually have a doctor's visit by virtual by virtual visit, meaning they can actually have a doctor's visit over the internet. They're able to communicate with their healthcare provider through email, through Skyping, and so it just gives you all sorts of solutions to give the patient the quality health care that they need. Things such as telehealth, e-health, telemedicine, m-health, these are all solutions to help improve um, healthcare outcomes for quality of life for patients. And I quote, the historic enactment of healthcare reform legislation recognizes the vital role of preventative medicine and opens new opportunities for improvement. So basically, all this is saying is that the government realizes that there's a need for advanced technology in the healthcare world. Um, is needed and is vital to the future of healthcare because the future of healthcare is advanced technology. This is how we're going to be able to bring about cures for terminal illnesses, not only chronic diseases, but terminal illnesses. Um, but the focus is chronic diseases because most chronic diseases are self-inflicted by, unhealthy eating habits, just in general, not taking care of yourself, exercising, eating right, getting the proper amount of sleep. And so, the focus of health informatics is to make sure that patients know that they have solutions. And then and that doctors and providers are able to give them that help that they need so that they're able to have quality life. Um, so the way of the future definitely is advanced technology. And preventative care obviously is the first step. Um, but having that option of advanced technology is definitely a key factor to helping patients get that quality health care that they need so that they can have that quality way of life. Thank you.